Uses of thrombolytics. Thrombolytics are used to dissolve the clot that has already formed, such as in MI, deep vein thrombosis, or pulmonary embolism. Primarily used thrombolytics can be LT-place, RAT-place, streptokinase, or urokinase. So these are the ones primarily used thrombolytic agents. Administration. The effectiveness of the thrombolytics is directly related to the time of administration, and thrombolytics are most effective if they are administered within the 4 hours of the clot formation. Narrow safety margin. As clotting is the desirable process to control the bleeding, but thrombolytics, they destroy every clot they encounter. So in this process, they destroy the normal clots along with the abnormal clots. So that is why thrombolytics have narrow safety margin. Coagulation labs. Prior to starting thrombolytics therapy, nursing to obtain the coagulation baseline for coagulation labs, such as for a PTT, PT, INR, or CBC. Client education. Explain the client the purpose of the procedure and therapies, and answer any client questions. Pre-therapy procedures. Prior to starting the thrombolytics, if needed, insert the IV line, arterial line, or Foley catheter prior to starting the therapy, because this will help to decrease the risk of bleeding from those sites. Monitoring. During thrombolytics therapy, vital signs are required to be monitored every 15 minutes during the first hour of the therapy and every 30 minutes for the remaining therapy. Dysarrhythmia. Client should be on constant cardiac monitoring because there will be a risk of dysarrhythmia once the myocardium regains its perfusion. Restrictions. Increase in activity will increase the risk of bleeding. So advise the client about the restriction in movement, and also to prevent the internal injury, client should be moved as little as possible. Contraindications. Thrombolytics are contraindicated in pregnancy, or if the client is having active bleeding, or in acute trauma. Cerebral hemorrhage. Cerebral hemorrhage is the major concern, so client should be monitored closely for any changes in the level of consciousness, any changes in the neurological status, and also should be closely monitored for any signs of bleeding, such as hematuria, which is blood in urine, and then melena, blood in stools, and then nosebleed, epistaxis. If any of these symptoms are noted, nursing to notify the doctor immediately. So that's all about thrombolytics. Thank you for listening.